Hi, my name is Carolyn Hughes. I am a third-year student in the Epidemiology and Translational Science program at UCSF. My research areas of interest are in maternal and newborn outcomes, including experience of prenatal, intrapartum, and postpartum care, and clinical outcomes among people with hypertensive disorders of pregnancy. I'm really excited to tell you about a study that I've been working on that looks at agency and autonomy in maternity care among women of color during the COVID-19 pandemic. Now, when we talk about agency and autonomy, it's an important component of experience of care and person-centered care. And person-centered care is really critical for all of the reasons you see here. And it helped motivate our study, which wanted to assess how the pandemic specifically affected people's experiences of care. Our study is part of a larger study that looks at the effect of the pandemic on reproduction in the US. And what we're talking about today is specifically a qualitative analysis that centers experiences of maternity care among people of color. We had 23 individuals in our final sample that were interviewed and their stories were analyzed. And when we did our analysis, we found that there were issues at the facility, interpersonal and internal levels that worked as sort of these levels, actors, and factors that affected individuals' experiences of autonomy and agency. You can see examples here of different factors at each of these levels that affected experiences. And we found that at that highest level of the facility or system, there were issues of stress, power, and lack of resources that had sort of a top-down effect, exerting pressure at the other two levels. And in their own words, our study respondents quotes, just a few of them are here, that talk about experiences that do align to those levels. And some of them actually speak to two or three levels within them. We really encourage you to view our poster, come see us at the symposium so that you can see more experiences and stories, including how they work within this framework. But in conclusion, one of the biggest things that we found is that many of the experiences that we heard from our participants were due to underlying issues in care. So not the COVID-19 pandemic, issues that existed before the pandemic and continue to persist and get worse through it. As you saw, that top-down level of issues around interpersonal factors being caused by those system-level stressors, and then those then in turn affecting those individual level sort of internal factors. Overall, we feel our study provides really important insights in how to potentially improve experiences of care and equity. But changes need to happen at the system, facility, and provider levels to make that happen. Things like addressing high patient load, potentially QI, quality improvement interventions, and things like provider training. Thank you so much for your time and in viewing this. Please reach out if you have questions. Come see us at the symposium. And thank you so much for stopping by to learn more about our study and our work. I would really like to thank the ARCS Foundation donors and coordinators. The scholarship means so much to me and helps enable this work and helps me achieve my goals of working on it and learn new methods. I also really want to thank the many mentors and people who support me in this work and the teams that I have the privilege of working with. Thank you so much.